Thank you, Jeremy. You did not scare me, but I have become more thoughtful. And I put on the mask. Well, who takes the floor? There are many questions that should be raised now. Sister Ellen? No? Not right now.
Thank you.
Anybody? Then no, Alexander.
I think that two phenomenons, long COVID and new variants, are the main arguments for strategy of choosing the strategy of elimination the virus. Like some countries, like some parts of Canada, like many states of Australia, etc., etc. Do you agree with this opinion?
I think there are many reasons to support the idea of elimination, but also important to mention that elimination is not an end point.
Yeah.
Elimination is a strategy, that every step we take, every policy that we implement towards elimination helps reduce the number of cases, reduce the number of severe infections and hospitalizations, and reduces the amount of long COVID. And every reduction in infection that we get is one less chance of a new variant emerging. So yes, I think that working towards elimination makes sense.
Okay, can I?
Please.
Okay, what are your? Because you mentioned some tools of suppressing the virus, some practical tools, technical tools. Can you say more about how to create an environment when we could safely work, about ventilation, etc., etc. When we can safely walk, teach, listen, practice, etc.
We are here right now. We are working, we are teaching, we are learning right now because we are taking a lot of precautions and a lot of measures. We just don't want to rely on any one individual layer. So we've all probably heard the analogy of Swiss cheese as a way to protect you. If you have one slice of Swiss cheese, that layer has a lot of holes in it. It's not a great protection. But if you layer those together, then you can create a very robust barrier against the virus. So when we start talking and saying, what can we do to be able to do more of life again? We are at that point. We know what to do. If we use vaccines, if we combine them with testing, combine them with ventilation, combine them with mask wearing, no, it is not a return to normal, but it's not a point in time in which we can think that this is going to be normal. What we can say is this is a way in which we can live our lives. This is a way in which businesses can run. This is a way in which schools can be open, meetings can be held. But we need to pay attention to layering those mitigation strategies, but we already know what they are.
Thank you. You did not talk about tracking. It is a very controversial issue. In some countries, it seems they have had very good results tracking the possible carrier of the infection and immediately isolating them instead of arriving to generalized lockdown. There is, however, an important issue of the defense of privacy. And what can you tell us about this?
It's a great point because I didn't mention it. And part of the reason why I didn't mention it is that we have very good tools that exist for testing right now, but we do not have very good tools for contact tracing that account for privacy, have really good public uptake and public trust, and have a good track record of being used effectively. We do have technological solutions that can work, but they need that public trust. And in a lot of areas, we don't have that. We're working towards that. There have been some very good examples, but it's a little bit more difficult to implement. Now, ideally, you combine testing and tracing, and this is what you want, because this is essential public health measures. So yes, we do want contact tracing, but it does have to be done in a way that has good trust, has good privacy, has good acceptance, and has good and very clear communication, because often we have failed to communicate why these measures are needed and how they work.
Jeffrey.
I'll keep my mask on too. I'm not sure who you mean by we in the statement. I'm just looking, I'll give you the data for today. New cases, well, I'll do it in absolute numbers. New cases during the last 7 days, on average in the United States, 103,000. In China, 29. Taiwan, 8. Hong Kong, 4. So there actually are good tools. I personally think this is a serious indictment of our culture and our norms about what freedom is and so forth. Not even a matter of trust exactly, just norms. We don't have the norms to behave ourselves, certainly not in the United States, but really not in Europe either. Whereas the 3 places that I mentioned, China, Taiwan, and Hong Kong, are very different societies. Every time I said China in the last 18 months in the United States, I'm shouted down because people are ignorant about China. But China actually controlled this the right way. Mass testing, a very important part of this is isolation. When people are infected, public facilities for that, not putting people back into their homes, which is what all of our countries have done. Serious contact tracing. And I was involved a lot with New York City, for example, during this pandemic. No interest at all, no capacity, not the slightest interest. Of course, they did a little, I shouldn't say not any interest, they did a little bit. And they worked hard at it, but there was never a norm of getting this under control. The norm was limit the cases, see what you can do, but the idea of actually trying to suppress the virus never was the goal. By the way, not in any of our countries in Europe and the United States. So to my mind, this is really something that requires serious reflection, because I think we misunderstand freedom. Seriously, in the United States, this is obvious. That's the freedom to shoot other people. But we really misunderstand pro-sociality, responsibility, what the limits are to what we call freedom. And so I just wanted to say we is not everybody. There are actually cases that suppressed transmission until today. They're being told every day, by the way, let go, live with it, and so on. And the Chinese are saying, no, thank you. We don't want 1 billion cases. We don't want to just live with it. We want to keep it under control. And my Chinese friends go about their normal daily lives, actually. The image that this means that they're locked at home is just completely wrong. But what we can't do, that China can do, is that when there were outbreaks, they tested 10 million people in a weekend in a city. Good for them. Let's learn something, because there's something to learn from that.
Hallelujah.
Jeffrey, you raised the fundamental philosophical question of what is freedom, and whether it is true that freedom implies a relativistic attitude in front of values, human life included. But we cannot go in depth on this. Perhaps on another occasion. It is a wonderful discussion, but again, all good things don't last for long.
Can I just add one very quick?
One last sentence.
Yeah, just one last sentence, which is that I think there's also a really important point that you just made there, which is that there is no one solution that can be applied equally to all places, because you have to look, again, at that community level, at how the different communities and societies work and adapt in that context. We have great tools and technology, but we can't just apply them in a blanket model uniformly and expect that they're going to work the same in all locations.
Okay.
Thank you, Jeremy.